right, welcome to the show. Today we have a guest that I'm real fond of. This is somebody that, one of the people that motivates me. I try to motivate a lot of people. And in my life, I have certain people that, sort of make me go to the next level in many areas. And this is Dr. Nick Masia. He's a chiropractor and he's an athlete. He's a serious athlete. He's a CrossFit competitor, champion. He's won many awards with it. He's very dedicated. He's dedicated to his diet. He's dedicated to his workout routine. When we first started working together, I thought I was in shape. I thought I was dedicated with my diet. And then, we started talking and I realized I had some cleaning up to do. And it's been great because he's sort of motivated me to go to the next level with my health. And I always look forward to any kind of conversations I have with him. He's a bright young man and he works at our office. And he's just someone I really admire. So welcome, Dr. Nick Masia, to the show today.
Thanks for having me, Dr.
Nick. How's everything?
Going good today. Day off from the office, a little bit of running around and getting this in. I'm happy to do it.
Awesome. Yeah, let's just say that, I think every chiropractor comes in for a different reason. My reason wasn't really an athletic background, although I've always been athletic. It was never really to that level where I was injured and went to a chiropractor and got results. A lot of my friends in chiropractic college that were serious athletes, like Dr. Fred Cleary that we had on last week, that's been their kind of thing. For me, I suffered migraines and went to a chiropractor and had great results, and decided I wanted to do that for other people. It fit a lot of my interests, and I won't bore you with that story. You probably heard it before. Other people have. So what motivated you to become a chiropractor? I know you have a significant background in swimming in college, but what was the final thing that you said, I want to do that?
One of the biggest things, so I swam in college, and so I went to Oswego. I basically started swimming when I was in the 6th grade, I think, and then swam all the way through college for Oswego State. So I was an athlete the whole time, and got into working out when I was in middle school and high school and all through there, and just loved the idea of being physical, loved the idea of being an athlete. Wanted to go to school for something like in that realm. So whether it was going to be what I thought in high school was, I wanted to go for physical therapy, actually, and I actually shadowed that for a little bit, and then found that I didn't really like it as much as I thought I was going to. And then one of my professors at Oswego was actually a nutrition teacher, and he was a chiropractor. So I became close with him, and then actually went to his office, got adjusted, followed him around a couple times, and I really liked what he did. I liked the fact that he was able to pick up that nutrition education and be able to translate that to students and his patients, along with being able to help people, whether it was because they were in pain. For me, it was more so performance, whether it was lifting weights or swimming or just being able to up my game a little bit. So that's really what sparked my interest in that. And he's the one that actually said, "Hey, why don't you try going to chiropractic college?" And so I applied and ended up going, and here I am.
Awesome. One of the things that I think a lot of people don't understand with our profession is how many different technique styles there are. I've counted up to 140 styles of chiropractic. And some of them, of course, I always tell people that half of them are kind of silly or been abandoned. Some of them relied on some kind of wild, technology that really didn't back up much. But the other half is amazing, and about a quarter of those are heavily researched, double-blind crossover studies for years and years. And each chiropractor kind of has a few they gravitate to based on their experience. A lot of times it's personal. For me, migraines is personal. So I always went after techniques that were part of the upper neck and resolved migraines and neck tension that led to migraines. And I know your techniques, when you first came into the practice especially, were fascinating to me because I had heard of them. I knew some of them at a very cursory level. And, hanging around you has shown me a lot of those techniques. So one of the things I always want to make sure any chiropractor has is a reason that sets them apart, something that gives them sort of their edge, and there'd be a reason to go to you and drive past 10 chiropractors from a person's house. Anytime someone says, I went through 9 chiropractors to get here, Dr. Mike, and it's 3 feet of snow, I'm usually pretty happy that they did that. And it makes you feel like, hey, this person's here for the right reason. So what's one of the things that you think sets you apart from, the standard, let's say a standard chiropractor, or from other chiropractors that have a very different approach?
Yeah, absolutely. So one of the biggest things for myself, I've been competing in CrossFit and weightlifting for the last 10 years. And that was a lot of it while I was going through school. So I was able to do a lot of continuing education and everything to better myself at working with athletes in that realm, I think. So having a chiropractor or a doctor that understands the demands that each athlete is going through, because maybe they're an athlete themselves, is, I think, one of the things that set me apart from others. And I know that's one of the reasons why I have some of the patients that I have and I get the referrals that I do. I know that at least once a week, I hear somebody say, I went to my other chiropractor and he told me, stop working out because you have arthritis or something. And I know that you're not going to tell me to stop working out. And I actually, I work very closely with a strongman gym in the area, and one of the strongest people I know, Tony Kayleys, and he works there. And this guy is a monster, and he lifts 400-pound Atlas stones over his shoulder, and he's 50 years old. So he sends me a lot. He coaches a lot of people. He sends me a lot of people because he knows that I understand what they're doing. I understand those demands of that sport and that type of competition, and I'm not just going to say, hey, it's time to hang it up, buddy. Like you can't do this anymore. So I think the biggest thing that sets me aside from a lot of people is that just understanding the different areas, and it's not just CrossFit. It's whether it's powerlifting, Olympic lifting, the strongman stuff. So that is one of the biggest things that I think just sets me aside personally. Technique wise. Oh, go ahead.
No, I think it's a valid point. I always want, if anyone wants to become a chiropractor and talks to me about it, I'm usually like, what's personal? What's going to help you? What's going to make you, go to that level and make sure that you're able to really relate to the person sitting in front of you. The patient sitting in front of you. I feel the person's pain almost when they come in with a migraine. I work with athletes as well, but you're going to know exactly that back squat, front squat, overhead lunge, what it did, how they did it wrong, what aspect, because you live it. And I think it's so important to enjoy what you do for a living. My father always said, never chase the money, chase your passion, do something you love. He had a very limited education and worked in a steel mill, and he didn't want me to do what he did. He had a job, not a career. There's some funny jokes Chris Rock put together about that I really love, that I won't try to make funny. But he had a really, and I followed that. And I think you're following that too. You're doing something you love. You're doing something within what you love, very specific to what you know. So that's awesome. One of the other things I noticed, in the time I've known you is, like I said earlier, your diet is incredible. And one time, I think you and I were joking around that we pretty much would swallow, chew on just about anything that would make us stronger, faster, leaner. When I recommend our protein shake to somebody, which is double Dutch chocolate, I mean, it tastes really good in my opinion, and someone comes back complaining it doesn't taste good enough, I don't even know what to say, because, I've been eating, kale juice and, and some stuff that's bitter, and so what, just shut your brain off and swallow this stuff is my recommendation. I mean, if anyone's ever watched Bear Grylls eat yak testicles, you understand this man has the ability to shut his brain off for the greater good of himself, let alone, his family and everybody else. So in watching, eating lunch with you multiple times, I've seen you crack open, different Tupperware containers filled with, extraneous odd things in there. But in a sense, people want to lose weight. They don't want to go to the level you and I have gone to mostly. So if someone comes to you and they're an average person, they're not, the crazies we are, what would you say to them as far as diet? How do you approach, and how would you simplify your approach to someone who says, hey, I got to take off 20 pounds, my cholesterol's through the roof. I'm just tired all the time. I know it's this extra weight. Tell me, Dr. Nick, make it simple. How would you summarize? I want to take some weight off. What should I do?
Yeah, so you're right. I pretty much probably would eat anything that's going to make me a little bit stronger, better than the next person, or healthier. It's one of the funniest things that we used to say when I started working out, and we'd always work out in these Arnold voices and pumping each other up, and we'd always joke around and say, you know what Arnold says, right? He goes,
Yeah.
if it don't taste good, then it's good for you. And so that still stands true with us today, I think. But for the average person, you can take it. Nutrition's funny because I fought this for a long time, and nutrition's probably one of the most important things for any athlete or just person in their well-being. But there's crazy levels that you can go to with that. So I fought the whole counting your macros and weighing your food out for a long time because I was like, that's a lot of work. I don't want to do that. And there's a lot of people who don't, and that's fine. So if somebody wants to if they would want to clean up their diet, the biggest thing that I try to tell people is to make sure you're at least eating enough, because under eating runs rampant. And there's a lot of misconceptions out there with, if I want to lose weight, I just need to stop eating. I'm going to drink celery juice and eat carrots all day long. And people end up gaining weight, or maybe they lose weight and they lose a lot of weight very quickly, but then they're not able to maintain that because it's not a sustainable diet. So the biggest thing that I try to get people to do is write down what they're eating through the day. Keep a food journal for a couple days to give me an idea of how much they're eating, how much they're actually consuming, and make sure that they're not under eating. The other thing is whole foods. I mean, the biggest thing that I'll tell somebody to shop and we've all heard this one, shop the outside of the grocery store. So when you're in the grocery store, there's a lot of crap in the middle of the store, and you go through the aisles, and that's where you're getting a lot of your processed sugary foods. You stay on the outside of the grocery store, and then that's where you're finding a lot of your produce, your meats, your dairies, your eggs, your things like that. In some stores, it's your beers. Stay away from that part of the outside of the store.
That's right. That maybe the dairy products too. For me, at least, I try to steer people away from that. But everything else that's refrigerated, I always remind people if the bacteria want to eat it, it's probably pretty good, right? I mean, you go into a dumpster, that's good food that has obviously gone bad at this point for our consumption, only because other bacteria have grown out to that degree. But refrigeration is obviously trying to slow that down. And if it digests that easy for them, it digests easy for us.
Right. So the biggest thing is whole foods and unprocessed stuff. So if it comes out of a box, generally I tell people not to eat it, and the other thing is drinking water, hydration. So nutrition and hydration go hand in hand with each other. So, those are the two big things that I always tell people. Well, three things, I guess. So you make sure they're actually eating enough within reason. Obviously, they don't want to overeat, but and it's as if they don't want to weigh out their food. So that's another big step. So that's personally how I got into where I am now, is weighing out and counting my macronutrients. Is I thought I was eating enough, and then I found out I wasn't. So, but counting isn't for everybody. So the biggest thing is make sure you're eating enough, and then quality whole foods. So basically trying to cook all your meals instead of getting them out of a box or anything like that.
No, I think that's great advice. I mean, to me, I've probably read thousands of books on diet, and one of the things that I really liked, that was paleo diet makes sense to me, and the macrobiotic diet made sense to me, because you're eating foods that have been around a long time, that are meant for us to consume, and in very simple, non-processed forms. And people don't realize the chemistry in processed food is designed to get you to eat more, have your taste buds literally swell up and super taste things, so they taste so good you just can't stop putting things in your mouth. Many people have eaten Pringles and eaten 4 canisters of them, and they're laying on the floor burping and feeling really pretty bad. But it's hard to do that with apples, right? You eat an apple, you might want a second one, maybe a third apple, and then you have this sort of like, wow, that's enough. But you don't end up in pain. You don't end up with a funny taste in your mouth. You don't end up with digestive disturbances of any magnitude, But yeah, I think the whole food idea, sometimes that term maybe is lost on people. They think it's a store. which obviously it is, but that I think that's the simplest way to eat, because you get to be full. People starving themselves, like you said, people aren't eating enough food often, and
Yeah.
I tell people a good diet, you shouldn't feel hungry. You're not going to stuff yourself, but if you're feeling hungry all the time, you're hungry. I mean, and that's that. And if you're working out, how are you going to build muscle and oxygenate and rebuild that body and have the energy to work out? You got to have some fuel in the fire. Absolutely. One of the things that we treat all the time, and the simplest thing, is back pain. And for our viewers, I was thinking to ask you, what are some simple things that you think people don't know that can help their lower backs? I have a million little secrets. I'm sure you do. Just share with us a couple of things that are basic, because lower back pain is rampant, and there's a lot of stuff that that person can do at home to slow it down, stop it, reverse it. So what do you say to that?
Oh yeah. Well, the biggest thing I think that's even brought low back pain, I mean, with people working from home now, that has been the biggest thing, and everybody's sitting at their computers, which, I mean, it was a thing before, but now a lot of the ergonomics are terrible with everybody working at home. So one of the biggest things that I try to get the point across with people is their back pain, it doesn't need to come from this big traumatic injury. It comes from the micro trauma that we go through every day. So pretty much poor posture. And the best thing that I can tell someone to do is see, sort of audit themselves through a day and see how their back is. If they're hunched over a computer all day and their low back is leaning forward all the time and they're flexed, then we need to make sure that they're going the other way, they're moving around. So I think one of the most useful things that I can get across to somebody is that they need to actually sit with better posture through the day. And that's one of the easiest things that we can do for ourselves. It's the easiest, it's the cheapest, and it's probably the most effective thing that we can do through the day for ourselves. I think that's one of the best things. Would you agree?
Yeah, you make a good point. One of the tricks I've done with patients is they'll claim maybe that their ergonomic situation at the kitchen table and the dining room chair is okay, or it's decent, or they're not sure. And I'll say, well, I ask them about their position on their body, where are they angled and all this. And then one of the things I'll do is say, okay, give your cell phone to your wife, your partner, one of your kids, and after you're working for 20 minutes, take a snapshot of you from the side. And you're going to see some of the most hideous postures that people get into, because the chair isn't really that great. They're having to artificially prop themselves, which then causes fatigue, and pretty soon the body is shrinking down and they're typing away, and it gets pretty ugly. So I usually want people's pictures, 20 minutes into a workstation, and see what they got. And I always tell people to get up and move around too.
Yeah, that's the big one too, especially now with the stand-up desks. I probably try to urge somebody to get a stand-up desk, a couple times a week, or I'm writing letters for it, or submitting some sort of form so that their workplace can get it. But some really good advice that I've heard from the stand-up workstation is not only just standing up all day, but go for a walk every couple minutes too, just so that you're not stuck in one position. Because prolonged positions, no matter how you cut it, whether they're sitting or standing, your body's going to compensate to figure out how to use the least amount of energy. So you're going to be shifting your weight from side to side. That's honestly the biggest bit of advice that I give people through the day, is how do you spend most of your day? How are you moving in the same position over and over? Because a lot of people can't figure out why they have low back pain. I never got in a car accident. I didn't hurt myself working out. It just I woke up like this. And so whether it's a position that we need to change when they're sleeping or through the workday, and that's helped so many people. So that's one bit of advice that I would give to people for reducing back pain. The other thing is just exercise. Or I mean, they don't if you're not exercising enough, and I'm not saying you got to go to the gym and squat a Volvo, but we need to get the muscles activated in your core to make sure that your low back is stabilizing itself. Otherwise you're just using your joints and your ligaments to hold you up all day, and you're not activating any muscles. So those are the two big ones. So I usually try to go through some real basic core exercises with people for stabilization, to get their abs working a little bit more. And then I get them to move around. Those are my two key things.
Oh, good. Yeah. One of the things that I like, and it's kind of maybe unrealistic for most people, probably 90% of people, but is the treadmill workstation, which I think is an amazing thing. I first saw a study on it one time. It was I don't know if it was a YouTube video, but years ago, where a guy took, five, in a big business, about 35 employees, let's say, in an office setting, and he took five walking, standing in a sense, treadmill workstations, and have people alternate 15-minute, very slow paced walks on there, bring their workstation up there. And it was really interesting. It looked like a treadmill, but it just had a desk instead of having all the screen and the buttons. Those were off to the side, and it was always going slow. They didn't incline it, and they just walked it out for a while, and they had all kinds of amazing results with people's health. People lost weight. Some people changed, got up some medication.
And the other thing with that, I've had people make them before, and sort of like, they've actually made like a wooden desk that you can basically move on, and it'll fit onto their treadmill, and then they can just put it on, take it away, and throw it in the corner when they actually want to run on their treadmill. So it's removable. And I have a couple friends who've made those. And they use them for studying it. One of my friends is in physical therapy school out in Virginia, and she has one up in her garage, I think it is, where she can study her physical therapy and everything. She's just starting out, so she's doing all the core classes and sciences. So a lot of time at the desk. So she made a desk that goes on the treadmill, and she can move around and everything, doing good. So
that's a great idea.
One of the best things I've ever seen.
That's a fantastic idea, and that's got to be, if you think about it, that might be quite simple. Probably taking a piece of plywood, maybe gluing on some small pieces, so it's kind of like rests or hooks on whatever screen or railings that you have on the treadmill. Like I said earlier, anyone that knows you take your health seriously. You're very motivated. You and I share that, and what we oftentimes will be kind of maybe amazed is the right word, that people don't take their health more seriously. They come in with significant problems, and they're not always willing to make the changes that you and I'd like them to make. And some of them seem simple to us, like drinking double Dutch chocolate protein powder and saying that it's kind of chalky.
Oh, good.
What do you do? What do you do to motivate patients to get them towards your level? I think you and I both are living examples of health. And that's something that I know helps motivate patients if it doesn't intimidate them. Because sometimes I've had a couple patients say to me, and I'm sure you get it, that, well, I'm not you. I'm like, well, I'm just trying to be a good living example. And I would rather get advice from someone who's in amazing health than someone who's in poor health, because that person appears, if not just genetically blessed, to have pulled something off. So how do you approach that motivational aspect with your patients?
Well, that's something that I think is a little bit different for each patient. So, because you're right, some people will get intimidated and especially, like, there's a lot of misconceptions out there about CrossFit. So, you tell somebody you work in a CrossFit gym, or you go to a CrossFit gym, like, oh, you're one of those people that's swinging on rings and walking on your hands and doing all this crazy stuff, which there is a competition aspect to that, but that's definitely not everyone. So when I'm trying to motivate somebody, I try to find out, like, what is important to them. So if maybe they want to talk about lifting in a gym, and if it's somebody who does work out, and okay, well, I used to be able to, lift this much weight doing this, and now I can't. So it's, like, okay, well, how many days a week are you going to the gym? What are you doing to get there? That would be one way to motivate somebody. It's just sort of, for me, like, oh, I went to the gym and did this, and maybe tell them about a workout that I did, and where, something that they may not have thought about in the past. Somebody who doesn't go to the gym, talking about the gym might actually intimidate them or get them to go the other way. So I try to motivate people to just go and just go for a walk, start small. I don't like throwing a ton of stuff at people, like, you need to go to the gym, you need to do this, you need to do that. or else it kind of discourages them, I feel like. So for me, like I'll talk a little bit about like, oh, I want to compete, I want to do this, or I know somebody who's done this, or did you see this person did this thing? So I think just talking about being physical sometimes motivate, and how good you can feel while you're doing that, whether it's physically or mentally, is a good motivation for people to actually get moving a little bit more.
And it sounds like you're saying also to meet them where they're at, right? Take them from whatever point they're at, and baby step them up an amount. I think that's
Exactly.
that's learned with time too.
Yeah, and that's because you get a lot of, especially this time of year, you get a lot of the New Year's resolution people. It's like, okay, I'm gonna hit the gym 5 days a week. Okay, well, you were hitting the gym no days a week a month ago, so just because you want to hit the gym 5 days a week now doesn't mean that's going to be sustainable. So I really motivate. I try to get people to go, okay, let's go once or twice a week, and then see how that feels for a couple weeks, and then we'll start throwing more days in and going from there. So yeah, taking people from where they're at. So whether it's not whether they might not actually work out at all, and so just going for a walk, and they might notice a difference doing that. So I do try to just get people to realize how good it feels to move more and be physical.
Yeah, there's so many approaches. Like I know personally, one of my approaches is to try to read the patient and think, how much can I push this person? Where are they at? And if someone is really kind of not responding, one of my more dramatic statements I'll make is, you can't help anybody from a hospital bed, because people tell me, I'm busy, I have children, I have a job, my spouse needs me, this and that, and that's all true. And we all, for me, I've raised 3 daughters, I'm married, and so I mean, there's a lot of stuff that takes up time and can take away from the time you put aside to work out. But it hit me, and maybe someone said it to me, and I don't remember. But you can't help somebody from a hospital bed, right? So you want to make sure that you're taking care of yourself and doing the right things, because it's not just about back pain; it's about your general health. You and I both coach people on diet, exercise, and we try to give them good life advice and to balance out their lives. So you make a good point on that. The next thing I want to ask is, people want to know how to get healthier. They like tips like that. So what would you say would be 3 things you can do, tell a person right now to get their lives to get healthier? 3 basic, simple, sustainable ideas.
So one of a couple of things we've talked about a little bit. So first question right off the bat is, how much water are you drinking? And is so things that they can do for themselves at home, or go off and get help from someone else?
Yeah, either one. I mean, really, probably things at home. I think people want to hear.
Yeah.
What are
okay, that's what I thought. But the first thing, how much water are you drinking? Okay, and someone says, well, I drink like 1 glass of water in the morning and then a coffee, nothing else. And then so that's when I really try to get people to, I say half your body weight in ounces a day at least, and then if you're active more than that, then that's great. So that's the first, that's number one. Second one is moving, right? Obviously we just talked about more movement. I think that's one of the biggest things that we both sort of preach in our office. And I actually said this yesterday to a patient. I said, I think movement is the key in this office, because that's what we're trying to accomplish when we're actually adjusting people also, is we're trying to get movement to joints that are stuck most of the time. And so moving, whether that's going for a walk and getting more steps in on your watch or phone, whatever is going to be whatever you record your steps with, and trying to get, whether I talked to somebody this week, I said, how many steps do you get a day on your phone? And they said 800. And I said, well, we need to get more than that. And I said, obviously we're not gonna go from 800 to 10,000 in a day, but we definitely need to make some small goals to get you moving a little bit more through the day. And I think that's what's going to help this person and her particular situation is she just needs to move more. 800 steps. I mean, that's like walking, getting up from bed and going to the bathroom and to your kitchen a couple times in a day. I don't think that's much movement at all. So just getting more movement is going to be the biggest thing. Third is sleep. I mean, for health to get, and that's going to be sound a little bit weird to some people, but you accomplish a lot in your sleep, hormonally, chemically. Your muscles recover in your sleep. It's one of the biggest things that I try to get people to do. And there's a lot of people who don't sleep out there. So they're up till midnight, watching TV, playing video games, doing whatever they're doing. And they get up at 5 o'clock in the morning, right? So if you get 5 hours of sleep every night, not so good. We need to get more sleep. And in the hierarchy of things that help athletes, right, is sleep is number one, and then nutrition. And then everything after that, those are the two biggest ones. Everything after that, whether it's training, your recovery, stretching, things like that, that stuff's irrelevant if those first two things are off. So sleep is an underrated tool for health, in my opinion.
Absolutely. I can hear the theme that it's master the fundamentals, right? Drink water, keep your body moving, and make sure you get enough sleep.
Yeah.
And I think anytime someone comes in with a complex health issue, they may be a patient from the past, let's say, or they're coming in with basic lower back pain, migraines, and then they'll bring up some other complex oddity going on in their body, and they've been all over the place, to the neurologist, to the primary, and everyone's mystified. They've had the CAT scans, the MRIs, and they're still having X, Y, and Z complaint. My first approach is, let's take a look and see if you're mastering the fundamentals. And I can't tell you how many times I have solved complex health issues with simple stuff. Nothing genius about it. I just said, let's go back and take a look at what's your water intake, how much movement do you have, and are you sleeping? So yeah. I think what you're saying is 100% on, and people seem to overlook that very commonly.
It is. They do, because it's the simplest thing that you can think of, and it's not something that's sexy and cool. Like, everybody wants this like new thing, like, oh, I want this new answer. I want to be able to take this vitamin or this supplement or this drug, and it's going to help me be healthy. Well, unfortunately, sleeping is not, telling people to go to bed earlier is not the sexiest thing that you could tell them. So they're not, it's something that definitely gets overlooked, I think. So when I tell people, hey, how much sleep are you getting? Are you getting at least 8 hours of sleep a night? No, I get like 3 or 4 because, I run around, I do all this stuff. And at the end of the day, I want to be able to watch TV or read or whatever, which reading is good, obviously, but we need to be able to prioritize sleep.
Yeah, I think a lot of people will almost, want, like, it's like a crown of thorns. People will say to me, I get 4 hours sleep, and I'm supposed to applaud them. They can do that.
I don't need sleep. I'll sleep when I'm dead. Well, yeah. It might be sooner than later. It might
be sooner than you think with that kind of schedule. I've also heard that the ultimate sleep cycle, and I don't know if I discussed this with you at one point, was to go to bed at 9 and get up at 5. And, obviously that's inconvenient. Could be near impossible for certain people. But I want people to know that it has been researched. And if you feel like garbage or you're dealing with a serious health problem, if you're trying to heal some of the worst imaginable health problems, your spouse and your kids and everybody can get out of the way and allow you to go to bed at 9 and get up at 5. And it has to do with lining up with the sun. And it's a long story. I won't bore everybody with it. But if you're ever in trouble, or if you just want to go to the next level, adding to your sleep comment, going to bed at 9 and getting up at 5. I did it for 3 days in a row. It was pretty inconvenient, but it works. You really feel a little stronger, a little more aware.
It's very inconvenient, but or at least the best you can get to that, and a part of that is just, to add a little bit more to that is being able to schedule your days a little bit better, being prepared for the week, like using your spare time to get ready for your day. Like, for us, we're at work all day long, and some people can work from home, and that's great, but there's a lot of people who are at their office all day long, or they're traveling for their job. And I think being able to get your ducks in a row in the beginning of the week or on the weekends or whenever you have your time off, whether that's cooking food ahead of time and having it available in your refrigerator, because that's the biggest thing that hinders people's sleep sometimes too. Is I gotta get home, I gotta make dinner, I gotta do this. So just having a way to get those things out of your to-do list, and you'll be able to get home from work, go to sleep, get up and go to work, not have to get up and cook your breakfast and do everything else. So
Yeah,
find
absolutely.
a system that works for you to get through the week so that you can
Yeah,
get home and get to bed at a reasonable time.
I think that good time management skills. Absolutely.
Yep.
One thing I ask my guests oftentimes is, what is your definition of health? It can be a complicated circus of an answer or a pretty simple answer, but how would you define health? Like, if someone's going to write down a goal and say, I want to be healthy, what is that?
I would say it's you asked me this when you hired me. I don't remember what I said 6 years ago. But
It was a good answer. It was a good answer. That's why you're on board.
I'm so I don't remember exactly what I said, but after working with you for the last few years and sort of like getting my own definition too of what I would think and what I would tell people is it's overall well-being. So whether that's, and everybody thinks it's a physical well-being. So we look at the different aspects of us, right? So physical, emotional, and chemical. When all those things are working correctly in unison, that's health. So you can totally have one and then have another. You can have your physical health, right? So you might look like a rock star. You might have six-pack abs and huge arms and everything else. Okay, so this person might look like they're physically healthy, but emotionally and chemically they're in the dumpster because they don't sleep. Their hormones are all off because they're overtraining. So there needs to be a balance. So I think that my definition of health would be overall well-being, physically, chemically, and emotionally, and not just too much eggs in one basket.
Yeah, I think one of the analogies I heard one time was you could look like a Ferrari, but if your tires are flat, you're not going anywhere.
Yeah,
Right.
exactly.
So the outside has to, it's important. The outside can be an indicator of the inside. Especially in Chinese medicine, we learn to read people's, tongues and eyes and skin color and tonal quality in their voice. All that puts together in a lot of the different healing arts. But obviously, like the Ferrari analogy, it's a beautiful car, but it doesn't go down the road without air in the tires or decent tires on it. So all three of those chemical, emotional, spiritual, physical aspects all have to be in alignment. I think that's a nice simple definition because people don't realize. Look at all the, like you said, eggs in the basket. Get all three of them right.
And that's
Right now, big topic. No, go ahead. I'm sorry.
I said that's
What?
a big thing that gets thrown out the window these days too. With you have social media pushing all the physical stuff, right? So you get people who look great and everything, but really what's underneath that is there could be terrible relationships and the rest of their life is a mess. But they look good, so people think they're healthy. So there's a big misconception going around right now, I think.
Absolutely. Well, another thing, like right now, the big topic, is the immune system. And, from you and I talking about how we feel about what the pandemic is and how it works and what can be done, people have a lot of external ideas, washing hands and the boring list of stuff that we've been said to nausea. But, if you were to tell someone, their immune system, how would you get someone to improve their immune system, make them a little bulletproof to what's going on right now?
Yeah, so I think that the first thing, I mean, what we do in the office, we adjust people, we stimulate the nervous system and the immune system with our adjustments, whether that's our manual ones or an activator or any sort of stimulation to that nervous system is going to boost the immune system. It's not going to make anybody immune to the virus, but I think that it's going to better their odds at fighting it. So first, getting adjusted, moving, being physical, stimulating your body on your own. I'm going to bring back the sleep thing because that's super important. You see these people who don't sleep, they sleep 3 or 4 hours a day, they're always sick. So sleep is important. The next thing that I push a ton is the vitamin D, and I know you do as well. And there's been so much research out there now with correlations of the severity that people are getting coronavirus symptoms to and their vitamin D. So if they have low vitamin D, they're getting hit hard with this virus. If they're a little bit higher, it's not as severe. It doesn't make them immune, and that's the big thing now is people think that you're trying to sell them vitamins and adjustments and they're going to be immune to the virus. I think that kind of got lost in translation with a lot of people in the beginning of this thing. But why not better your chances at fighting it?
Yeah, and there's so much research on coronaviruses as well as flus from the past, and and how dramatic it is by someone's vitamin D levels in their blood and the severity at which they get the virus. You make a great point saying you're not going to be immune, but you are going to be able to fight it better when you're healthier. You think of who's really in trouble with this virus. By and large, it's going to be the sicker, less healthy people. There's always examples of people that are young and healthy that have a hard time. And as science progresses, we'll figure out why those people had such a hard time. And it's a horrible thing to have this thing take a life of a 25 or a 30-year-old person. And it doesn't make sense right now. But I think someday it will. We got through the AIDS virus by figuring that one out. We'll do the same thing with this one. But meanwhile, yeah, I encourage people, same as you, to move, to be vitamin rich. And the whole foods that you mentioned earlier, are part of that, right? Because the phytonutrient content in a red beet is linked to your hormones, and your hormones are linked to the strength of your immune system. Younger
Correct.
people are healthier in their immune system because their hormones are more in a higher level, as well as the fact that they have better oxygenation, open tissues, better blood pressure, and all the beautiful things that come with youth. And they tend to move more. Not always. You get a lot of people that are just immobile from day one through their whole life. But I think it'll be interesting when we figure out why so few kids are affected by this virus as well. I look forward to that research and the understanding there.
Interesting, for sure.
It's fascinating.
The other, like, if we want to, get into the supplement thing and sort of keep it simple, because you could, people could take supplements up to the coming out their ears, but the vitamin D and then minerals. I think a good multi-mineral is huge. There's so many people who are deficient in minerals and magnesium in particular. Magnesium and zinc are the two big ones. And our body zips through both of those things when we're under stress. And I think magnesium deficiency runs rampant also with a lot of people. So if I were to throw another supplement out there that people could take that would be ideal, would be minerals.
Absolutely. Minerals. I listened to a YouTube video this morning with a doctor that did a lot of research on quercetin, and he's recommending quercetin to decrease the cytokine reaction in the virus, which I think is fascinating. Of course, he's come up against some heat for no good reason, actually, because he's got incredible research on it. He's not shooting from the hip on this at all. But yeah, I thought that's interesting as well, to keep that sort of an allergic response, an inflammatory response, more accurately, from occurring, right? So, there's numerous chiropractic techniques, like I mentioned earlier. And, the number I throw around is 140 of them, and half of them are, very real. And then there's only a few practiced very commonly, and there's only a couple taught in chiropractic colleges. Most chiropractors go off and learn other techniques, as they grow, and sometimes while they're in school, but at separate seminars. What techniques do you utilize? Maybe name them and then describe what they're best used for. So
number one that I use every day, at 90% of the time, is manual diversified adjusting. That's what I like the most. People will gravitate towards what they like. That's what works the best on me. And so that's what I use on the majority of my patients. And that's basically, that's the one that most people are accustomed to, I guess, is the popping and the cracking of everything. That's what everybody says.
Very classic style that if you throw on a YouTube video of a chiropractor making noise out of somebody with microphones on and having a fun time with that, that's what you're going to see, right?
I do a little bit of everything, depending on what that person, what that patient needs. Not everybody likes that style of adjusting. So I'll use flexion distraction. Which is basically a table that gets the spine to flex a little bit while creating space in the lower back to distract those joints from each other. at getting that spine to move a little bit better. Another one is activator, and I use both of the non-electric and the electric one that we plug into the wall. It's like that little jackhammer, so to say, where it can deliver that impulse to the area. So activator is also a misunderstood technique, I think, to a lot of people, because what it does is it stimulates the body. It stimulates your nervous system. It's not, people think, they're going to go to an activator person, they're going to hit them with this gun that's going to move their joints around. And the idea behind activator is that it is going to deliver a very fast little impulse to the area. Your body's going to recognize that as stimulus, and it's going to bring some more attention to that area to help heal whatever's going on there. Exactly. And the other technique that I use a lot is like our non-osseous technique for the neck with migraines and the cervical spine, where we're basically really just trying to mold that spine to move a little bit better without using any very quick movement or not getting any popping or cracking out of that. So those are the ones that I use daily. We also do a little bit of drop table for the pelvis, where we're able to sort of, if we have an SI joint, something like that, that's not moving the way we want it to, I'll use some drop table on there. So those like 4 or 5 techniques that I use on a daily basis.
Exactly. Yeah, I think what the comment you made about the activator being a stimulus, I oftentimes tell people that I look for stagnation in the body and create a stimulus. And if that stagnation is mental, it might be something that I say, a phrase, or recommend a book, share a philosophy on something, share a personal experience on something. But if it's the spine, we're going to take a tool of some type. Sometimes that tool is simply our hands. Other times it is a device that is a little sneakier. It's faster and more pinpoint. And, to adjust a person that's had spinal fusions, that has a shunt to their brain, that has, fragile ribs, osteoporosis, all these very conditions that make a person very gentle, you need a gentle technique. You really can't disturb somebody that's not made out of the type of material that someone like you is made out of. Your bones are probably twice as thick as the average person because you have hundreds of pounds on your back when you're marching around in the gym. And that's fantastic, right? Makes you a little more bulletproof. But understanding, even a guy of your stature understands what a fragile little baby needs and what an osteoporotic 95-year-old woman needs. And you have those tools in your tool belt, in a sense, to be able to bring them out and do the job necessary.
Yeah, and that's the biggest thing. I mean, twice last week, I think I had 2 new patients who came in with osteoporosis, and they had gone to chiropractors in the past, and they said, I don't want to get cracked. They walked in the door, and that was the first thing they said. And I said, don't worry, I'm going to go through an exam. We're going to figure out, I'm going to talk to you a little bit. We're going to do a history. We're going to make sure that I find the best thing that's going to work for you. And that technique that I'm going to use on that person isn't going to be the same one that I'm going to use on the guy that's coming in lifting 400-pound stones over his shoulder. So that's another thing that is I like difficult when people see like a younger guy coming in and maybe he works in a gym and they just think that this chiropractor is younger, healthier, stronger, going to come in and pulverize somebody. Right. Sitting down and talking with them, and saying that we have a lot of different options of what we can do. It's not just the traditional rack them and smash them and.
Yeah, I think what's important too, and I learned this while I was in chiropractic college. The guest I had on last week is like 6'2", 330-pound power lifter, and he's been almost that size, roughly that size, the entire time I've known him. And being adjusted by him was incredibly gentle because he was using 10% of his strength to adjust me, and that meant he had complete control over it. When someone doesn't have the physical strength that they need to be a chiropractor doing manual techniques, they're using all their strength. And when you do that, think of hitting a baseball as hard as you can swing. You're probably not going to hit it. Same with a golf club. Kill that ball and see what happens. You're going to miss it. Or you're going to scull it. You're going to send it in the wrong direction. So one of the things I do, especially as I've been, a little older than 40 now, is, get in the gym and stay strong, right? I do things to stay strong. So when those big dudes come in, I can take care of them because I have guys, 6'4", nearing 400 pounds once in a while. And they look at me like, you're going to adjust me? And I go, yeah, I'm going to adjust you. Get on the table, and I can do it, right? But then in the next room is an infant, and in the next room is a 91-year-old osteoporotic woman. So, being an experienced chiropractor and someone who's careful and knows when to be gentle and knows when to, go in there and use a credible force to break through, 45 years of scar tissue and calcification and mineralization and, the body fat and the muscle tone and the lack of stretched hamstrings on this, giant human being. You got to know when to use what, right? And you learn that soon, but you get better at it and better at it the more you do it.
Right.
So
And
cool.
just talking to people too, you find what emotional, what is going to work good for their personality too, based on, how they come in emotionally too. Remember, that was one of the things that we talked about: physical, emotional, chemical. I mean, emotional is one of the big ones. And that's one of the ones that's been hardest to learn, I think, in the last, because that comes with experience. So in the last 6 years, I think that I've been able to figure that out a little bit more too. Like, this person might be able to tolerate a manual adjustment, and maybe that's what you want to do on them, but emotionally they don't want that. So that's where it's become more comfortable at not doing that. Okay, this is what I want to do, but this is not what I'm going to be able to do. I have to change my approach because this person is not going to respond well to that mentally.
That's something that I watched you grow into as I've watched you practice, because when you first came in, of course, you were from the gym. You're a big, strong person, and that's the type of people you worked on. But when you have a general practice, you're going to get all kinds of people. And I could sense in the beginning you were sometimes disappointed when you had to do gentle work on somebody because you're so
It's true.
doing bigger work, on big, strong people. But I think you're becoming so much more comfortable and happy to be able to do, hold back the tide a little bit, understand that a lot of people don't want to jump into, 35-degree water to shrink their body down and get rid of toxins. They just can't take it. They're used to a warm blanket and a pair of slippers. And
Right.
Those people need our love and caring as much as anybody else does. And for that, we got to understand some people cannot tolerate, whether it's physical abuse in their past, emotional abuse, or they're just a gentle person. They don't like a lot of body stimulus. I'm probably on a 1 to 10, like probably a 7 or 8 over what I can put my body through. You're probably a 9 or 10. Some people just love a good frozen lake to jump into, or straining weights over their head and half crying. And if they don't do that, they don't feel alive. And I relate to that. Believe me, I relate to that, and I'm a little like that. I wouldn't do the stuff I did, but I also, I may not relate, but I understand. I don't relate emotionally, but I understand when people just really don't like a lot of stimulus. And that's when we bring techniques that meet their level of tolerance for stimuli, right? I mean, that's how I look at it.
Absolutely. Yeah. And it's you're right. It's been a fun thing to grow into a little bit, learning how to, read people and know, what you think is going to be better for them rather than what you would have done in the past, for myself, at least.
Well, I know one of the concerns you and I have talked about in the past, it was a little while ago, was sort of the future of natural healthcare. In the time I've been in this field, I've seen it sort of expand and contract at the exact same time. And I think it's kind of confusing to the average person, because just when I think we're making strides and people are coming more towards natural healthcare as an answer to their challenges, you see, some opposing forces out there that are destroying it, mocking it, belittling it, doing stuff like that. And that's, I guess, just going to keep going on because, in my opinion, the drug companies and the powers that be, really would love to sell more anti-inflammatories, painkillers, and muscle relaxants. And obviously, when you get adjusted and start sleeping and drinking water and moving, you don't need those kind of things as much or at all in your life. Everyone knows these drugs have a level of toxicity. They're not the first choice by most people. Most people do want to live a natural life, and they just maybe don't have the discipline, or they've fallen out and they're ready to come back in. It's our job to help nurture them and bring them back into a more natural life. But the future of this profession, always concerns me because I love it so much. I like that it's a distinct and separate healing art. I'm not real fond when other people attempt to do chiropractic things. I think physical therapists should stay in their zone. I stay in my zone. I love physical therapists. They're fantastic. There's things that they do. I have friends and all that kind of stuff. I work out in the gym. I work out of my house. I do physical therapy, like things to rehabilitate my broken parts. But I like the idea of a manual adjustment, that style of treatment as well. So, briefly, give me an idea from your vantage point, being, a little younger and coming out of school when you did, and what you see when you look forward to the years you're going to be in practice. What are your concerns? What do you think's happening in the profession?
I think a couple things. I think it's going to depend on who you are in this. I think that you need to be an advocate, or you need to be an advocate for healthy living and natural healthcare, because if you're not pushing it, then you're going to get mowed over by the drug companies and insurance companies. I think but I think that it can be good as long as you can defend why you're doing it, and show that proof of how it works, why it works, and so on and so forth. I think that this pandemic is going to be a big eye opener for a lot of people. So I think the future of natural healthcare is going to be good. I think it's going to, I have high hopes for it, because there's a lot of people looking to improve their life and their health. And I think with all the vaccines and everything that's coming out, people are sort of saying like, hey, well, maybe I should take my health into my hands and become healthier. So I think, and I've said this for a while, I think our office is going to be full of new patients looking to get healthier. I think the gyms are going to be doing really well too, and because everybody's seeing what the comorbidities are of this specific virus and what's happening now. So I think when people are going to start coming out of their houses a little bit more, I think they're going to be looking for ways to become healthier. I mean, you're already seeing it a little bit with people buying things, exercise equipment at home. I think that them exercising and things like that, and now vitamins are starting to get pushed a little bit more. That's what I see, at least. And I think that natural healthcare, I think it's going to be a good future for it, honestly. As long as you can actually, defend why you're doing what you're doing. If you're just there hanging out, I don't know how well someone would do, but I think that you need to be able to defend why you're doing things, prove why you're doing things, be an example of the results that you're going to get by living that lifestyle.
I agree. The founder of chiropractic, I believe it was the founder, maybe the founder's son, said that the future of chiropractic is as bright as its theories are true. And I think that holds true for anything in life, right? If you have truth, you have power. And if you can get that truth out and you can back it up with evidence, obviously you're going to have a very strong approach to healing people and to getting people to the right place. I'm not a big fan of a lot of what I've seen in big pharma and in some of the industrial complexes that are running our farming. And I think there's so much awareness now from this virus and from the pandemic. Like you say, the comorbidities, I think people really will, a portion of those people really are going to step up and do the right things. I think that's crucial. All right, guys. So anything else you want to talk about, Dr. Nick? That's pretty much what I wanted to cover today. Give people an introduction to your style and what you do, and get people up to speed on what we're thinking and what our approach is to chiropractic, and what it is in our office, and how we feel about our patients, how we feel about the profession, and where it's going.
Yeah, I think we covered a good chunk of it there.
All right, guys. So thanks again for tuning in. We're going to be doing these weekly, releasing podcasts like this. We're going to have different guests on, and we'll have you can find us on Spotify, you can find us on YouTube. Just look us up. Pretty much it's under my name. And have a good day. Thank you.
All right. Thank you.